Hey, it's Dr. Matt Sarik here from Back and Balance Clinic, and today we're going to talk about some rehabilitation exercises for Achilles tendinopathy, so stay tuned. Achilles tendinopathy is a common injury that is characterized by pain and swelling in the bottom two-thirds of the Achilles tendon. While common in runners, it can happen in other sports such as volleyball, soccer, as well as sedentary individuals. Because tendons are responsible for absorbing and transferring loads between tissues and bones, in order to effectively treat Achilles tendinopathy, one of the most important things that you can do is load the tendon. In this video, we will talk about an evidence-informed progression exercise program to help you treat your Achilles tendinopathy while trying to prevent the boom-bust cycle and flare-ups. One of the things to think about when we do want to treat Achilles tendinopathy is how do we prevent the boom-bust cycle? In order to prevent this cycle, we need to exercise within a level of tolerance. There might be a couple of questions you might be asking yourself. Should I completely avoid exercise? According to Silbernagel et al., exercising into pain doesn't necessarily mean you're making things worse or creating further damage to the tendon. And in fact, exercising into a tolerable pain level can facilitate the rehab process and help with recovery. What is a tolerable pain level? This is actually dependent on you as a person. Think about what your level would be on a scale of 1 to 10. If you are comfortable with exercising with a mild level of pain, or a 3 out of 10, then that is what you can do. Someone else might be comfortable exercising into a higher level of pain, or a 5 out of 10. There are some strategies that you can use to determine the level that is right for you. First, monitor pain levels during exercise, after exercise, and the following day. Is my pain tolerable during exercise? Is my pain better, worse, or the same after exercise? Is my pain better, worse, or the same the day after exercise? And this last one is really important because it can give you information on how you are responding to the current intensity of the exercise program. If you feel good during and immediately after, but worse the next day, it might be a sign of doing too much too soon. And you can use a daily activity as a baseline, like walking, getting up from sitting, going down the stairs, or any of the exercises we prescribe below. If there is a flare-up, it doesn't necessarily mean you did any damage, but it is a sign to decrease the volume or intensity of the exercise going forward. The exercises presented here have two main goals: to build capacity and to restore function of the Achilles tendon. These exercises we'll go over here is in line with the Silbernagel combined loading program, which incorporates both eccentric and concentric exercises, progressing in weight with faster loading stimulus. This program also uses some of the Alfredson protocol, which involves primarily eccentric exercises. Keep in mind that this program is dependent on your symptoms and level of injury. This is just a guideline, and if you are questioning how to progress, please get a proper assessment. In phase 1, which involves weeks typically 1 to 2, you want to perform exercises once a day, and they should be slow and controlled. Isometric calf raises, 40 seconds with 4 sets. Double leg calf raises from the floor, 3 sets of 10 to 15 reps. Single leg calf raises standing on the floor, 3 sets and 10 reps. Seated calf raises, 3 sets and 10 reps. And eccentric calf raises standing on the floor, 2 feet up, 1 foot down, 3 sets of 10 reps. In phase 2, which is typically weeks 2 to 5, we start to add more eccentric exercises. Here, perform the exercises once a day. Double leg calf raises at the end of a step, 3 sets of 15 reps. Single leg calf raises at the end of a step, 3 sets of 15 reps. Seated calf raises, 3 sets of 10 reps. Eccentric calf raise on the edge of a step, 2 feet up, 1 foot down, 3 sets of 10 reps. And quick rebounding double leg calf raises, 3 sets of 20 repetitions. For this one, imagine you are jumping without leaving the floor. In phase 3, which can be anywhere from weeks 3 to 12, intensity can increase by adding speed of loading or adding weights, for example, a backpack or a weight in hand. Single leg calf raises at the end of a step with weight, 3 sets of 15 reps. Seated calf raises with weight, 3 sets of 15 reps. Eccentric calf raise standing on the edge of a step with weight, 2 feet up, 1 foot down, 3 sets of 15 reps. Quick rebounding calf raises, 3 sets of 20 reps. And for this one, you can progress to single leg when able. And plyometric training, so incorporating things like jump rope, hopping, jumping on and off a small step or a box. This is where we try and get a little bit more sport specific. In phase 4, which can occur from weeks 12 or even up to 6 months or longer, is for maintenance. In this phase, we have minimal symptoms and are able to participate in sport without much difficulty. Continue with this phase until there are no symptoms and continue to perform exercises around 2 to 3 times a week. Single leg calf raises at the end of a step with weight, 3 sets of 15 reps. Eccentric calf raise standing on the edge of a step with weight, 3 sets of 15 reps, 2 feet up, 1 foot down. And quick rebounding calf raises, 3 sets of 20 reps, which you can also progress with single leg when able. These are some of the rehabilitation exercises for Achilles tendinopathy. There's a lot of reps, but take your time, do the exercises slow and progressive, and build up gradually over time, and you'll be back to running in your sport in no time.